Have you ever wondered why some medicines work for one person but not for another? It's a common misconception that all medicines work the same way for everyone. Welcome to the world of pharmacology, the science that seeks to understand this phenomenon. Imagine the human body as a complex lock system, with each lock representing a different function or process. Medicines or drugs are the keys that can unlock these processes. But as you might guess, not every key fits every lock. It's a process called drug-receptor interaction, the cornerstone of pharmacology. Drugs work by binding to specific receptors in the body, much like a key fitting into a lock. When the drug or key fits into the receptor or lock, it triggers a response. This could be anything from reducing inflammation to slowing heart rate. But here's where the misconception comes in. Not all keys fit all locks. In other words, not all drugs work for all people. This is due to a variety of factors, including genetics, age, weight, and overall health. For example, a young, healthy person might respond well to a certain drug, while an older person with underlying health conditions might not. This is why doctors consider many factors before prescribing medication. So, how do scientists discover which keys fit which locks? Welcome to the fascinating field of drug discovery. It's a process that involves understanding the human body at the molecular level, identifying potential locks, and designing keys to fit them. This process begins with a target, a molecule in the body that plays a role in a disease. Scientists then search for a compound that can interact with this target. This is done through a process called screening, where thousands of compounds are tested against the target. The ones that show promise are then further developed and tested. But it's not enough for a drug to simply bind to its target. It must also reach the target in the body, which is where the concept of drug delivery comes into play. This involves understanding how a drug gets absorbed, distributed, metabolized, and excreted, collectively known as pharmacokinetics. Now let's break this down. Absorption refers to how a drug enters the body. Distribution is how it travels to its target. Metabolism is how the body processes the drug. And excretion is how the drug leaves the body. Each of these steps can be influenced by many factors, further contributing to the complexity of pharmacology. So, what have we learned today? Firstly, we've debunked the myth that all medicines work the same way for everyone. Instead, we've discovered that drug-receptor interaction is a complex process influenced by many factors. Secondly, we delved into the world of drug discovery, understanding how scientists identify potential locks and design keys to fit them. Finally, we explored the concept of drug delivery, learning about the journey a drug takes from entering the body to leaving it. Pharmacology is a fascinating field that seeks to understand the complex interactions between drugs and the body. By understanding these concepts, we can better appreciate the intricacy and sophistication of this vital science.